embodies this transformation as a pioneering force in health equity. As professor at Eastern Michigan University School of Nursing and director of the Center for Health Disparities, Innovation and Studies, she's revolutionizing our understanding of health disparities in Asian American communities. Her groundbreaking research and innovative interventions in cancer control, chronic disease, and mental health haven't just earned her the prestigious Robert Wood Johnson Foundation Health Equity Award and the Laurel Award for Health Equity, they've changed countless lives. Dr. Wu stands as living proof that when brilliance meets compassion, barriers fall and healthier futures rise in their place. Ladies and gentlemen, please put your hands together and welcome nurse, researcher, advocate, our lovely keynote speaker, Dr. Tsu-Yin Wu.
Good morning. It's so wonderful to be here, and thank you for this amazing kind of an introduction. And I am just so privileged to be here in front of you and allowed me to share my passion, the work, and research with you today. And I would like to call out for wonderful, amazing work that by organizing committee of AIWA. And I believe that I was here since, the first, few AIWA IWD day, and just very honored to be, brought back today with you. I know that in just a couple of months, that so much has changed. And a lot of us feel insecure, uncertain, and even overwhelmed by all the news and what's happening. In these challenging times, the best defense is to stay informed, prepared, and united. Kudos again to AIWA and all the sponsoring organization, amazing leaders, to bring us here together so we could unite together as we witnessed several attempts to reshape the federal government recently and other important rights related to immigrant rights and social safety net. It can be easy to just feel helpless, hopeless, but there are many reasons to feel hope. I would like to share with you a few insights and collaborative work that on the topic I'm charged today, which is gender equality in the field of health and medicine. So, the first topic I would like to share is women's health. It's becoming an increasingly recognized and global health issue because a lot of recommendation guidelines in medical society recognize the underdiagnosed and undertreatment of women. It is therefore so important for us to think about how do we better deliver the effective healthcare, and to properly diagnose these conditions as well as institute preventive services and measure in achieving population health. So, what the data tell us? The recent national representative data from breakfast, and it's a kind of big, acronyms. Behavior Risk Factor Surveillance System. That's a system that you will see, for some of the students there, breakfast, that is reporting our health status for U.S. People. And so the latest survey actually shows that there's a significant portion of women have difficulty accessing the medical care, even after controlling their health, the incomes, education levels. And so they also report that delay the healthcare access, ability to see a doctor due to cost. So this is again some things that brought to our minds that women's health, there's inequality there. For Asian Americans in particular, there's a significant portion of Asian women receive what called a discriminatory experience. 1/3 of them that they actually, during their encounter, that they have some kind of discriminatory practices with the providers or in the setting. So that actually associated with the poorly health and functional outcomes. So for CHDIS, Center for Health Disparity Innovation and Studies, that we have been one of the 23 national teams been funded by CMS since 2014, enactment of the Affordable Care Act. We have been instituting one of its own services. We have about 35 bilingual navigators out there helping people. A lot of them, they are limited English proficiency immigrants. They just came here, don't know the system very well. So each year that these bilingual navigators help them to get the healthcare coverage through the marketplace, federal marketplace, Medicaid, CHIP, and other programs. And this year alone, our wonderful CHDIS navigator have helped more than 4,000 individual Michiganders to get insured. And these people at the end could get to the medication they need or the medical services that they require. So we are very proud of these navigators, and even though we already received the notations that the funding is going to drop 90%. But we are still standing strong because our program officer told us that we are one of these programs that in the nation that achieve what we said we actually, have 300% of, overall, of what we said we are going to achieve. So we are really proud of that. But we need more of this effort, moving forward in the next few years. Next topical area I want to share with you is something that I've done a lot of work. Do you know what's the leading cause, number one, leading cause of death for Asian Americans? Want to get a guess? Heart disease? Anybody else? Did I hear cancer? Yes. You either came to my talk before for the health disparity or you just know it. Thank you. Very nice. So cancer, actually in Asian American, not only women, Asian American as a total, is the number one cause of death. And it takes about 25% of the death accounted for that. And I want to talk about cancer screening because it's an efficient way to detect the cancer in very early on and then, decrease the mortality. And so this is, where that we see the cancer screening has been a very important medical procedures, but Asian American women actually still fall behind in the three major cancer screening: cervical, breast, and also the colorectal. So just give you a few kind of number to play with. Up to date, cervical cancer screening rate for Asian American, 68%. White Americans, women, 71%. And African Americans, 73%. So there's about 4 to 5, even actually 7, 8% of difference. For breast cancer screening, Asian American women, it's about 70% up to date. Again, it's still behind the white population and African Americans, about 10% of the gap. The last one, colorectal cancer screening. So anybody has done this year, your 10-year kind of mark after 50? For colorectal cancer screening, it's the biggest gap for Asian American women. So it's 53% up-to-date screening rate. But for whites, it's 67%. So there's about 14% of gap. for Center for Health Disparity Innovation and Studies, we are very fortunate that we have received the funding support from MDHHS since very beginning. I think, even before, we have the center, that we help to administer the breast cervical cancer control navigator program known as BCCCNP since 2007. So our bilingual navigator, mostly women, that they help the most vulnerable group, which is low income, uninsured, to get mammogram or pap smear. And then they're not only just helping them get into the program, they actually help them to get to the appointment. And during the appointment, interpret and answer help, between the link between the providers. So really that this program by the BCCCNP and CHDIS altogether help the women to benefit from the screening and also lower the risk of dying breast and cervical cancer. The last topic, very happy, is firearm violence. I know that I've been drawn this, I'm a researcher, I'm a nurse by training, but I've been drawn to this gun violence topic is because that this remains an unchecked crisis in this country. And I will show you some of the, hopefully, the statistic why. It disproportionately affects the community of color. And during the COVID pandemic, we all experienced anti-API sentiment leading to the surge of hate crimes and discrimination. Tomorrow, March 16th, it marks the 4th anniversary of Atlanta spa shooting, where a white man shot 8 people, and 6 of them are Asian women. The Atlanta spa shooting were not just an attack of individual, but horror reflection of growing anti-Asian hate that has years of experience of xenophobic rhetoric. A recent Stop API hate actually report shows underscore these hateful narratives still going on impact our Asian American communities, influence public attitudes, exacerbating the racial inequalities. Center for Health Disparity Innovations has been forefront in addressing these 2 public health issues, which is racism and the firearm violence. In past 2 years, we received 2 NIH grants to study firearm and how it impacts Asian American communities and finding solutions. So as you can see, some of the slides here showing the evidence base and data why Asian Americans need to pay attention to the public health issue. So the left-hand side shows our preliminary data during the COVID. We already know this is an issue, and that's, I think, back in 2022. So the reason is that, in the start, I will share with you this kind of how the journey started. There was a Burma Center, our long-lasting collaborator, the ED, Todd, kind of emailed me, correspond with me saying, hey, I got a call from the local gun dealership. The owner came to me very concerned. They say, how come your agent came out to buy, guns? I never see them, or I hardly see them before the pandemic. And so, Todd and I kind of start looking at these issues, and later on that we see the media portray saying Asian Americans all kind of, they all went out to purchase a lot of firearms. So we did a study using the survey and finding that a lot of them say they are the first-time owners. So meaning that they haven't got a gun, but then, because of the reason that they need a protection. So they went out to go to get a gun. And so we also find out that, some of the safety issues is that they don't safe storage it. They put the guns, loaded. They also, put the guns a lot, which is increase safety issue, increase risk. And the other ones that I think very concerning to us is that these gun owners also carry out more often when they go out. For the past 3 months, they actually carry more than half of the time. Again, there's a reason for them to do that. It's due to the protection. So in terms of the, what would be the gender-based inequity in the firearm or violence? And this is, again, a very disturbing statistic. Do you know that for Asian women, about a quarter to half in the United States, they experience intimate physical or sexual violence in their lifetime? And more than 7 in 10 intimate IPV, which is intimate partner violence, homicide in the US, 7 out of 10, meaning 7%, they involve with a gun. And 76 of the intimate partner firearm homicides, guess what? The victims are women. So the rise of anti-Asian racism and violence disproportionately hurts Asian women. Because of these negative consequences, think about mental health, depression, self-harm, suicides, reproductive outcomes, the unwanted pregnancy, miscarriage, STDs, and in the long term, it has a long-term sustaining intergenerational traumas. So the public health approach of these violence and firearm-related issues definitely has to start with prevention. Because I know that Chinese has a saying, I'm sure that India or somewhere, you also have this, prevention is the best medicine that we need to prevent before it happens. So that calls out to some very, very powerful, effective policy regulation, which has to come from the science as well as evidence. And also, we need to make sure that when we do that, we're not doing it alone. We need all the help. We need to have our organizations, communities, and all the discipline and legislators coming together to address this problem. Education, why? That is also very important that, to prevent the gun violence. And that can take many forms, and including promotion of the safe storage. Remember I talked about the free carrying and more carrying outside, and that poses risk. And if you have a store at home or at some place that unprotected, that the people like youth or children or unauthorized person could access to the firearms could pose potential risk and lead to incidents or injuries or even fatalities. And we actually seen quite a few in Asian American community just last year. And I don't know if you follow the case or not, but I'm happy to talk to you about how several youth in our community, because of the mental health crisis, had guns and been shut down by here in Michigan as well as in East Coast. So earlier I said that we have received 2 NIH studies that we would like to work with our community addressing this. The study that we are currently conducting, one of them is Adaptable Community Engaged Intervention for Violence Prevention, Michigan model. Because we really want to make this as exemplar programs that we can replicate national-wise. So this is one of the federal investment in violence preventions, and we are working with companies, we are working with the communities and many other stakeholders on this multi-level interventions. to address and empower, equip ourselves in proper knowledge and access to a safer communities. And I know that I probably have more to say, but while we all agree we need a sensible legislation for firearms, most importantly, I think the solution comes from us, comes from the communities. And we need to equip our communities with lots of good information and knowledge to protect ourselves, especially when it comes to firearms. This year's conference theme is #Accelerate Action. Hope is an action. Hope is movement and joining the battle on the field. Firearm violence is a gender justice issue. I encourage you to work with this. I encourage you to participate, involve, and engage. If you're interested in working with CHDIS in any of the programs, particularly the firearm interventions, we are trying to make it as a Michigan model, please reach out to me. I love to talk to you, and we will love to train the community residents to become the leader, safety coach, to work with us to make our communities more safer and healthier. Thank you for your attention. Thank you for having me.
I'd like to invite Sharon down to. I know that's how nerve-wracking your findings were. And Sharon just exhibited that a little bit. No, this is Sharon now, a little memento for our keynote speaker, Dr. Tsu. And what we've heard right now, healthcare is such a rigid system. So Dr. Tsu is one of the prime examples of when systems are built on bias, the courage that you show, when you act the right way, make the right choices, I think that's some powerful change. And this is so profound, the work that you're doing. Thank you so much for all of that. Appreciate it. Thank you.